Hi, my name is Kim Bradley, and the article that I found is entitled Preference Assessments in Older Adults with Dementia. As cognitive impairment progresses, individuals with dementia gradually decline in activity and activity engagement due to difficulties initiating leisure activities independently and effectively communicating their preferences. This includes such activities as gardening, knitting, golfing, and even crossword puzzles. Low activity engagement has negative implications for mood and quality of life. Such things as depression can occur and disengagement with friends and family. Preference assessments allows them to express themselves and giving the individuals a medium of communication and participate in activities they actually enjoy rather than just remaining dormant. Caregivers and long-term care staff are faced with the challenge of finding enjoyable objects or activities to engage individuals with dementia. This programming may be further complicated if preferred leisure activities have not been identified prior to the onset of cognitive decline. As a result, activity preference is often ascertained through caregiver reports when collateral information is available. However, the literature suggests that caregiver reports are often imprecise and inaccurate. These challenges contribute to decreased engagement in activities. To address the difficulty, preference assessments can be effectively used to determine the likes and dislikes of an individual with dementia. The risk of developing most types of dementia increases with age, such that 5 to 8% of younger old adults between the ages of 65 and 74 are impacted, and up to 25 to 50% of these in the oldest old category, that's 85 and older, experience cognitive impairment robust enough to impact their daily lives. In some, The present study assessed the utility of PA or preference assessment and its stability of preferences over time. That is 1 to 6 months after initial assessment. In a sample of older adults with dementia, the average age being 82.25 years with a standard deviation of 6.52 years. Results supported the use of preference assessments as an assessment procedure to assess preferences for items or leisure activities in adults with moderate to severe dementia. The majority of the participants exhibited stable patterns of preferences over 1 to 6 months, suggesting that preferences may remain stable for some individuals with dementia. In summary, this study provides further support to the utility of preference assessments and to our current understanding about the stability of preferences over time among older adults with moderate to severe dementia. The literature also suggests that preference assessments may inform interventions that assist in problematic behavior such as agitation, promoting activity and increasing the quality of life for this underserved population. Thank you very much for listening, and I look forward to listening to everyone's video. Have a great night.